So how I structured the presentation is I would talk about, I would start a bit of a history about how systematic review started, and then go into the different type of reviews we do and why and how and where they are useful. And I've used a lot of examples for each part of them. I should say I'm not big in making fancy PowerPoints. I keep obviously PowerPoint simple. So one of the things is all of us as researchers, we have to at some stage assimilate and put together research before we do new research. We want to know what happened, what implication, what conclusion we can make, and what are the next steps we make. One of the things when I was a younger researcher, I was fascinating is that despite the importance of this literature review step, the amount of information or guidance you have about how to conduct them to be appropriately conducted is quite limited. And that's one of the reasons when I got involved in evidence-based healthcare, which is my primary research field, or they also call it clinical epidemiology, I got really interested in the systematic reviews because it made a lot more sense about having structure, how to do these reviews. A lot of the initial methodology around systematic reviews comes from clinical research, and the story is because this person is one of the people who inspired that movement of a systematic review. I should say, actually, the first early stages of the concept of systematic review actually came from astronomy and physics. It was a way that when they had different observatories with different observations, they were trying to find a way to bring them together to make a conclusion of it. That's how it originally started. But then when it came up into healthcare, it picked up again and became quite useful and famous, and then moved away in other fields into environmental science, software engineering, business management, and international development, and even crime and justice. So, but historically, one of the key people in this movement was somebody called Archie Cochrane. He was a Scottish doctor, and he raised the issue that he was criticizing the profession of medicine that we have failed as a profession to bring together all of the relevant clinical trials to answer a question. The reason he raised the clinical trials because clinical trials are the ones that you compare different treatment on patients. And this is the closest that we have on clinical practice, but we still don't bring them together to answer a comment, at least not in 1979. He didn't do anything, but a guy afterwards called Ian Chalmers, who's still alive, built an organization called Cochrane, trying to make an international movement that people bring together clinical trials into a systematic review to answer clinical practice questions. The story Ian says about why he did it started with, he was working as a World Health Organization doctor in Palestine. He had patients, children patients with certain diseases that he wouldn't give a certain treatment to them because he learned in the medical school that's not what you give them. And then he realized there were 5-6 clinical trials out there that if somebody had put them together, he would realize that would have decreased mortality and death in his children, and he didn't do it because that information wasn't available in the synthesized form that the person who wants to use it can take them and inform their decision making. That's how the movement started. And at the beginning, it focused a lot on trying to bring together clinical trials. So a lot of the methodology was initially developed for that. So how we do, but afterwards it has been expanded a lot because when this systematic reviews became a very basic of informing policy and practice, like now a lot of countries use them to inform policy making, it started to be used for other type of question that's not only like questions about treatment we use, but also in other areas, like about toxicity of certain chemicals in environment, or should we use body camera for crime and for police officers to reduce crime, and a lot of other questions, and a lot more methodology was developed. So what is a systematic review? Systematic review is technically, going back to the point that I was making earlier, is that it's technically trying to have a methodology about that is that minimizes the risk of bias in the process of collecting information and synthesizing them. So what we usually do is we start with a very defined review question. for systematic review, you need to have a focus question. And sometimes we consult stakeholders for it. We talk with people who might be using this review or the researchers to kind of come up with a good question. Then we would come up with a way and a decision about where we look for information. It depends on where information is available. A lot of you use electronic databases, but also where we can ensure that we have a balanced view about the literature. For example, if you only use high impact factor or very famous journals to do your literature review, one of the limitations you have that the editorial decision around what papers should be accepted or rejected affects your literature review. Like in healthcare, it's very much, you can actually, with clinical trials, you can have actually, there's evidence that's quite binary. Like if you get a discovery, a positive result, it gets published. It's a negative result, it's less likely to be published in a famous journal, would be less journal. So if you only look at papers in the famous journals, you end up thinking everything, all of these things work. And you don't see all of the studies to show where the failures are or where it doesn't work. And if you're familiar with statistics, you easily can introduce a systematic error in your literature review because you're only getting the ones that had a significant result and ignore all of the research that had shown there was no significant results. And if you bring them together, you might realize that what you thought is significant is actually not. So that's the developing research strategy. We developed the research strategy based on how we can have a balanced review. Then we usually do a very systematic data screening and data extraction process that we would at least involve 2 people. The reason of it is that as content, especially if you're an expert in the field, you have biases about what people like and don't like, and we want to ensure that our individual views about it doesn't affect this process a lot. Then we usually do have a quality assessment of the studies before we try to synthesize them. The data you are synthesizing in systematic review is as good as the quality of the underlying data. And you need to know how the quality of the underlying data is before you synthesize them. After we synthesize the data, we make a judgment of the quality of the body of the evidence, but all in total, what the quality is, and then we develop recommendations. In each of these steps, we might involve certain stakeholders. When I'm talking about stakeholders, I don't know whether people are familiar with this. I'm talking both about people, and in different literature, they're using different terminology for a different definition for it. But we are talking about people, both people who are the target, like people who are using the information we want, people who might have a stake in the process. Like if you're doing something around software engineering, you want to talk with software engineers who works in companies who would develop this, especially if you're like doing just a smart review about the quality process. You want to involve people who usually do this process, quality indication, to understand, did you consider all of the issues relevant to them in the review? One of the things, I know I can speak very fast sometimes, so if I do that, feel free to stop me and tell me I'm talking too fast. I do talk fast, but I get excited. That means I was talking too fast. Yeah, okay, I slow down. So yeah, but people can, every time if I'm talking too fast, either unmute yourself or put a comment and I would slow down. So reviews can be, have a very, oh, sorry. What's doing here? So, do you see the screen? So reviews can have a very specific question that's more focused. This is an example of it. It is a question about giving, so when mothers they think they might have the baby too soon, they sometimes give them an injection beforehand. It means the baby is more healthier. It's a very famous systematic review, this one. So what they did, they found all of the clinical trials that compared them, and they found 30 clinical trials, and they did a quality assessment. This is a demonstration of how the quality assessment looked. Green means good, yellow means unclear, red means not very good. And then they synthesized the data for each of them. We call this forest plot. So what the forest plot is, just a very simple introduction. Each line is one study, and the vertical line that you see in between is the line of no effect. And this bigger blob means that where the effect size is, and this is the confidence interval. If it's on this size, it means the treatment favors corticosteroid. If it's at this size, the blob, it means it's favoring control. If it crosses the line, it means the result was not significant. So these are the number of people in the studies. For clinical research, like 100, 200 people is not a lot of people. So you see, it's a lot of small studies that couldn't show significant result, but when we synthesize all of the data, we find out that the treatment works. So sometimes when you do lots of small studies and you cannot reach a conclusion, like systematic reviews can help to build that power, but not only demonstrate that it's significant, but also that it shows that it is generalizable because it's study done in a different kind of context. In a lot of the reason I put this example first, this is pregnancy and childbirth, just because in Chalmers was obstetrician was one of the earlier areas that we did systematic reviews a lot, and because at the beginning they did systematic reviews, then demonstrated we have a gap of evidence. A lot of research was done afterward to fill up the gap. Areas like my area, which is dentistry, my primary education was at dentistry. So you actually we don't have that luxury. So there's not so much research because we started doing systematic reviews later. So we unpack the problems in our field later, so there's much more gaps. So we usually have a lot more inconclusive reviews done. That is one of the things you see with systematic review. When you start trying to do systematically look at evidence, you realize a lot of areas that you thought you have a lot of research on, a lot of the research is actually quite low quality, or badly reported that you cannot use the data, or has other problems of it, and the amount of information you have that you can make a conclusion is quite limited. And that's one of the other values of review. Sometimes it kind of unpacks you where the problems in your literature rise. So this is another example of a systematic review, but this is much more broader. This is a question was about, this is a review developed because of COVID-19. Because in COVID-19, one of the things they, like for a long time, you were not allowed to go to a dentist, or a lot of procedures were not allowed in the hospital. The reason is any procedure that causes aerosol, like there are like droplets in the air, because if you go to a dentist, they use a bear and splash it around, it can increase contamination. So this is a review of all of the procedures that kind of, we can stop the spread of those aerosols in a dental practice. So these are lots of different interventions that we are looking in one review on. And when we did the search, we couldn't actually, we had to do a systematic search. So, when you do a systematic search, just show a kind of an example of it. Usually we have a combination of words we use from the question. Like in this case, we would like think about different words of that is relevant to dentistry, different words related to the intervention. But each electronic database we use has its own characteristic. This is using Medline, which is a medical database, with Ovid, which is a search engine. Like in university, you have access to these search engines and databases, and I think if you have a library induction, they should have showed you how to access them. And these databases usually have characteristic how you can do a search much more comprehensively. Like for example, here, if you look at it, it says scale adjunct polishing. What it's trying to say is they want to search any article that has these words, 2 words apart from each other. So it helps you to be a bit more accurate about searching when you use this kind of search engine. In my field, and it's increasingly developing in other fields now, is we also have what we call study design filters. So like some information specialists have done a lot of testing about what combination of word helps you to find what study design. This is an example. This was a clinical trial one, but there are the study design filters for other type of research studies, and you can use them in combination with your words to increase your possibility that you can pick up the study design that you're looking for. So in this case, for example, unlike like the other review example, it was one comparison we are looking at. Here we are looking at a broader area with lots of different comparison. And if you look at it, despite the fact we found lots of studies, but for each question, there was quite limited studies there. one of the others, and this is the quality assessment of the studies. Everywhere that is yellow, which is a question mark, means the reporting of the article wasn't adequate to make a judgment call. And this is an increasing problem we see in the literature, is that sometimes, even if we find all of the studies we need, if the study didn't report adequately detail, you actually cannot use the data or the information there. And there are lots of movements going on currently, and I would encourage you to look at it if you're publishing papers. It's called reporting guidelines, trying to make researchers follow a certain reporting standard to increase the possibility that they provide all of the information we need to make decisions about what works and what doesn't work. So, so one of the things is I do also want to highlight is that with quality assessment can cover a lot of things. In a lot of cases, one of the aspects we want to look at quality assessment of an individual study is systematic error or bias. Bias can be a wider thing, but when I talk bias in this presentation, I'm just talking about statistical bias in the form of systematic error. We are not when we do a systematic review, we're not only interested in the systematic errors on the individual level of the study, but also risk of bias on the body of the evidence. A very good example is publication bias. Like I already mentioned, positive. If you get a positive result in a study or a significant result, it's more likely to be published. It's more likely to be published in English. It's more likely to be published in a famous journal. So it is important when you run the review that you have strategies in place to minimize that bias. For example, I would always search for conference abstracts, because a lot of people present work but they don't necessarily publish it. It gives you an indication how much unpublished literature exists. Dissertations, I will look into it to see how much unpublished literature exists that might be negative studies, in some fields has been increasingly popular to register the studies before you do it. Looking at registries gives you an idea of studies that has been registered, started to happen, but they weren't published. When I talk about different biases, risk of biases has not been randomly chosen, which often we look in a systematic review. We do studies we call meta-epidemiological studies. So what we do is that we take all of the, for example, a study from a student study design, clinical trials, cohort, cross-sectional studies, and then compare them based on their result on different methodological characteristics and see whether the better quality and the lower quality studies show different results based because if they have only one item different, but the difference in the quality is only in one item. And if we see developing empirical evidence that this is an issue, we would include in the systematic review when we do reviews as part of our risk of bias assessment. Like, for example, at the beginning, we only looked at publication bias in general, if it's published or not. Some of our meta-epidemiological studies showed that it doesn't only happen that people publish or not publish the paper. What people do is they measure a lot of measurements or outcomes or indicators, but only report the ones that have interesting results. So even the selective reporting can happen in an individual study, in addition to whether the whole study gets published or not published. So at the moment, we also, in addition to publication bias, we look at selective outcome reporting because of him. Sometimes this thing is, sorry. Okay, we cannot always guess, we're always guessing what people publish or not publish. There is actually a statistical test called funnel plot that you can use to give you an indication whether you have publication bias in your literature or not. It is a very, it has a lot of false positive, false negative. This test is not perfect. Technically what it's doing is expecting, if you have studies, if all of the studies that are done in the field are published, you would be expecting that the smaller studies are more widely spreaded because of the less precision they have, and the bigger studies for better quality are more around the effect size that you're expecting to see. If you see an asymmetry in the data, in the distribution of the data, you would make it, you say probably you have publication bias there, that some studies were never published. As I said, it's not a very accurate test, and it only works when you have a lot of studies. So, but it is useful sometimes to have an indication when you have a probability of publication bias in the literature or not. So I also went off and found some example, because I thought most people who would attend, a lot of you would be working in computer science, and the area that actually increasingly seeing systematic reviews is software engineering. And they have been not only looking at, there have been enough done that there have been studies done on the systematic reviews to identify the gaps and problems they have across of them. But one of the things I want to highlight is that alpha systematic review started as the first systematic reviews that were quite extensively done was in clinical trials. A lot of the methodology were shaped by that. When more people in different fields, from environmental science, international development, education, software engineering, started to do systematic reviews, we came up with a lot more variety of the questions that we needed to find ways to address them. And a lot more methodologies how to synthesize them. So you see a lot more range of terminology in the literature for different types of systematic reviews. I'm not saying I'm an expert in all of them, so there's some of them I have never done, but some of them are a bit familiar. I'll just give you an idea about some of them. Partially also because I know some of your postgraduate students, like any students I have, they have to do a systematic review as part of their master or RESM or PhD, but because the questions will vary, there might be different methodologies that are appropriate for them. So, for example, in one of the methodologies that's become increasingly popular is network meta-analysis, and that is when you have situation when you don't have a direct comparison of what you're looking for, but you have a lot of indirect comparison that other people have done. So what you do, you make a network of different studies and identify them, and try to see whether, if you want to compare, for example, this one and this one, whether you can see indirect evidence from different comparisons, an indication what probably could work or not work. And it's also a useful thing when you're comparing more than two things and are interested in it, to get an idea to how to rank those interventions by all of those different comparisons you have. That's called a network meta-analysis. You see a lot of for some questions, a quantitative analysis is not appropriate. So you have a lot of cases that what you're interested in is more about people's views, perception. So you're looking at putting together information that are interviews, ethnographic studies, and so on. Like this study, which was not trying to come up with a kind of like a quantitative effect estimates. It was trying to come up with more framework about the requirements of a management framework. In this case, they did a framework synthesis. What this means is they started with a general framework on their work. So they categorized the studies they find across this framework, and then make conclusions based in each of those categories. So that's one of the non-quantitative ways of putting literature together. My laptop sometimes goes to the next slide, sometimes not. So one of the other things you will see, the examples I have given, was all of them were about very focused question. Like we had a clear question you want to answer. Sometimes the issue you're addressing is a broad question. It might be because you have a broad area that you're working in, or it might be because the area is too immature. The literature, the research around is still on the early stages, so you don't have a lot of clarity about some of the details, or it might be because that you want to have a sense of what's happening in the literature before you try to come up with a focus question for your systematic review. So we call that systematic mapping or evidence mapping and so on. It has similar stages like a systematic review. So you start up with a scope, you do a systematic literature review, you might or might not do quality assessment, but you would have a data extraction sheet. But how you present your data is more about categorizing them about where the knowledge are, where the studies are, where the knowledge gaps are. Like example is this one. This is about where forest-based activities have any contribute to reducing poverty. This has to do because a lot of those remote areas, remote communities, the interaction with the forest is important in bringing in food or other kind of resources that they need for it, or for economic development. So what this mapping review was trying to do is identify what type of activities has been studied and what type of poverty outcomes they have measured, and gives you an indication where the most amount of research is and where it's little on. And depending on which question you consider important, it helps you identify where you most likely get a clear answer from a policy practice perspective. You do a systematic review, but also which areas where there's very little research and there's a lot of opportunities for new research to coming in and happen if that area is important enough. There is in all of this example I gave you, a lot of them had so we were trying to find an answer. We usually call it aggregated reviews when we want to come up with an effect estimate. We want to come up with an answer: is this working or not working? Is this has an impact on something or not? But we have also a concept that conceptually these reviews are called. There's the configurative reviews, which are we are trying to understand its scope and area of an area. A good example to compare them is these two questions. So the first question: do students in classes where let me just remove this one so I can read my own slide. Do students in classrooms where there is a classroom teaching assistant get higher or lower scores in test scores? That's aggregated question. So when we do the literature, we want to come up to one answer. We try to synthesize the data together. But as the second question, how can we conceptualize the way that the presence of a classroom assistant changes relationship between student and teacher when teachers in the class? Is a configurative question. So we are trying to, rather than to come to our answer, we actually want to expand it, understand all of the different themes in that area to understand what's the level and scope of the issue. So an example of it is I had a PhD student who was working on referral pathways in dental practices, that happens in primary care. Primary care is referring anywhere else, not at the hospital. That happens in the general practice. And she wanted to first understand, before she does her own study, what is the scope, all of the issues are discussed in there. So she did a configurative review rather than an aggregative review. So she found studies in different groups and then tried to find out all of the different themes around that area that it is, and then use that as a basis for her designing her research question for a PhD. Now there's so many systematic reviews done. There's now overview of reviews. I know kind of sometimes it sounds funny. It sounds like a review, how far we go with the review of reviews, but they are quite useful, especially if you have a series of systematic reviews who are very small questions and doing an overview of them. Sometimes give you an overview on our area. An example of it is this one, because changes in trying to do how health system works is quite complex. So you have lots of different reviews looking at different aspects, and then we bring them together as overview of reviews. An example of one is, we didn't publish it yet. We are still waiting. We have to get approval from different level of the World Health Organization before we publish it. So what is happening was, we wanted to develop a framework for European countries to guide them how to do national research priority setting. So we were looking at lots of literature reviews that were done on different aspects of how to prioritize research, bring them together and build a bigger frame, using that to build, use that overview of reviews to build such a framework. There are the type of reviews that I have there's a type of review called realist review. I don't have a lot of experience in it, but there's somebody in the medical school, Karen Husk, if you want interested in it. They're called realist review. So rather than trying to figure out whether something works or not works, you want to understand why it is working, all of the different mechanisms. So what they do a quite broad search strategy, but then have an iterative process, how they gradually build up this information together to understand the underlying mechanism of it. Nowadays, because of also kind of the whole things with COVID-19 and everything, we are we are in a world that we have to be responsive quite quickly sometimes to things that are happening. So now there's a concept going on called the living reviews. And it's also based on this concept that reviews can get out of date very quickly. You do it, even when you do a PhD, at the beginning of your PhD, you do a literature review until the end of the PhD, this review is out of date and you have to update it again. And sometimes this has implication, especially if a study comes in as important. So there's this concept of a living systematic review, that is a document that is updated regularly. There are some issues around that, because you don't want to update too quickly, because it's like a test that if you test something several times, at some stage you have a random error, get positive, so you might get a lot of false positive of an effect of something that you're thinking is significant, because you're updating it on too short terms. So there's lots of discussion about how to conduct them and how to update them, and there's actually a living map of COVID-19 studies at the moment out there. There's another concept comes a lot. Doing a systematic review can be a lot of work, especially when you're doing it with a big question. You have lots of different study designs, and trying to make sense of it can be really complicated. I know people who would prefer to do 100 primary studies but never touch a systematic review, because trying to make sense of a body of evidence can be really complicated. So they take a lot of time. But nowadays we are trying to talk about how we can shorten the process and be quicker in responding to them. And there is also a lot of discussion about that maybe we should change the publication structure of the whole scientific literature, that is more dynamic, so we have a much more dynamic evidence ecosystem, that data can be fed into it and information can be updated and be used more responsively. But this is a kind of much more bigger discussion, but it's a discussion that's going on quite, at the moment, is quite active. I did want to touch on an issue about that we talked about. Systematic reviews are used both to inform policy and practice. They're very popular now to be used in policy and practice, and but they are kind of I hope you didn't want it to cross over feature research, but so yeah, evidence-based. So not only for the use policy practice, at the moment, like a lot of information that you get from World Health Organization is based on systematic review, like whether you use mask or not, whether you use lockdown. But there have, as you have seen also across the presentation, I also talked to my PhD student, systematic reviews can be very helpful in understanding how to guide future research. One of the big areas is you can see where the gap of research is, whether the gap is really existing or not, but it also helps you to understand what are the different methodologies people tried, what does work and what didn't work, what are the elements of a study designs that has not been used there, like what outcomes have been never measured, what worked, and what outcome measures has been previously measured. We are actually working on a network called the Evidence-Based Research Network, which our focus is trying to think, what are the things we need to consider if we conduct a systematic review that's purely for informing future research and is not relevant to policy and practice, and what are the implications of it? This is an interesting example of showing you why is it important to do systematic reviews. So this is something we call a cumulative meta-analysis. So what does it do? Each time a new study is done, rather than being separately, it shows each line is a combination of the new study and the previous study's effect. So here, and this is the same comparison in all of the studies done. Technically, here in 1994, we knew what the answer was, but because nobody was doing a systematic literature review, people were doing the same study again and again when there was no point of doing it, because we already knew the answer in 1994 about it. So there were lots of studies done afterwards with no good reasons. And that happens, that still happens these days. And at the moment, some of the funding agencies now require you do a systematic review before you do future research. I know it's more now predominantly in healthcare, but it is like some of the funders do fund more than healthcare, and they're starting to kind of adapt it in the other fields and at least discussing it. So it might be some conversation that might come up in future discussions about other when you apply for funding or want to publish and so on. It is spreading in other research areas. The areas that I know that has been increasingly being strong about is like environmental evidence, environmental research at the moment, and I would say international development, but and in other areas like business management, software engineering, and so on, they are still in early stages. But it is likely that with less research funding becoming available, this becomes a more important issue for other funders in the future too. So like some of my funding agencies I work with, I cannot apply for funding if I don't demonstrate that at least somebody has done a systematic review to definitely show there's no evidence on that. There's not enough studies done to answer that question already. So one of the projects I'm working on currently is working with the funding agencies to understand how they're using systematic review in the process. In practice, it's a bit more complicated because this decision is who does a systematic review, who decides if there's a systematic review done, what counts as a research gap or not, is it the peer reviewer, the committee, who checks the review was done properly and the decisions have been made, and how do we ensure that when they fund the study, that the study goes back into a systematic review, existing systematic review, and keeps the cycle going that people inform it properly. So that's one of the projects I'm currently working on. So yeah, but yeah, there is, I know the joke existed that where we put the stop point is how meta we go. I don't think I would go above over. I don't think I ever want to in my career to do an overview of reviews. I think overview reviews is a good ending point. But I think it demonstrates a need of us looking at the meta level of what we are doing to recognize where the problems are. And when we are just looking at one primary study and look at all of the quality issues in that, instead of looking at the quality of issue of the body of evidence, we miss a lot of important points. So thank you very much, everyone. I hope that was what we were looking for. That was helpful. And I'm happy to answer any questions if anybody has. Mario.
Thank you very much for the presentation, Mona.